Diabetes and erectile dysfunction are two prevalent conditions that often coexist, impacting a significant portion of the population. Diabetes is a chronic health condition where the body struggles to regulate blood sugar levels effectively, while erectile dysfunction is a common sexual problem for men, characterized by the difficulty in achieving or maintaining an erection. Despite their distinctive natures, the relationship between these two conditions is critically interlinked, affecting numerous aspects of an individual's health and quality of life. Understanding these two conditions in unison is crucial as it sheds light on how they may exacerbate each other. This introductory section will set the stage for a deeper exploration into both diseases, looking at their causes, effects, and the intricate ways in which they interact. The aim is to provide a groundwork of knowledge that is both accessible and informative, ensuring that all readers can grasp the significance of the relationship between diabetes and erectile dysfunction. In this essay, we will delve into the essential details about diabetes and erectile dysfunction, backed by recent scientific studies and research. By understanding the nuances of these conditions, individuals can better manage their symptoms and improve their overall health. The subsequent sections will break down each condition, explore their interconnection, and offer practical advice for managing the dual challenges they present, all in a tone that is friendly and easy to understand. Diabetes is primarily categorized into three types: Type 1, Type 2, and gestational diabetes. Each type has distinct characteristics, causes, and implications for health, making it essential to understand their differences. Type 1 diabetes is an autoimmune condition where the body's immune system attacks the insulin-producing cells in the pancreas, leading to insufficient insulin production. This lack of insulin means that glucose cannot enter the cells to be used for energy, causing high blood sugar levels. This type usually manifests in childhood or early adolescence, often requiring lifelong insulin therapy and careful monitoring of blood sugar levels to manage the condition effectively. On the other hand, Type 2 diabetes, which is more common, results from the body's inability to effectively use insulin, often exacerbated by poor diet, obesity, and lack of exercise. Unlike Type 1, Type 2 diabetes can sometimes be managed with lifestyle changes alone, though medication or insulin therapy may also be necessary. Gestational diabetes occurs during pregnancy and usually resolves after childbirth, though it increases the mother's risk of developing Type 2 diabetes later in life. This type requires careful management to ensure the health of both the mother and the baby during pregnancy. The causes of diabetes are a complex interplay of genetic, environmental, and lifestyle factors. While genetics can predispose individuals to diabetes, lifestyle choices such as diet and physical activity play a significant role in the development and management of the disease. Genetics play a crucial role, especially in Type 1 diabetes, where family history significantly increases risk. If a close relative has Type 1 diabetes, the likelihood of developing the condition is higher. For Type 2 diabetes, lifestyle factors such as a high-calorie diet, sedentary lifestyle, and obesity are predominant contributors. These factors can lead to the development of insulin resistance, where the body's cells do not respond effectively to insulin. These factors lead to insulin resistance, a condition in which body cells do not respond normally to insulin, making blood sugar management problematic. Over time, this can result in elevated blood sugar levels and the onset of Type 2 diabetes. Understanding these types and causes is crucial for managing diabetes effectively. By recognizing the underlying factors, individuals can take proactive steps to prevent or manage the condition. Knowledge empowers individuals to make informed decisions about their health, which is particularly important given the chronic nature of the condition. Education on diabetes management can lead to better health outcomes and a higher quality of life. Managing diabetes well is a cornerstone in preventing complications, including erectile dysfunction, which we will explore later in this essay. Effective management involves regular monitoring, medication adherence, and lifestyle modifications. Moreover, public health initiatives often focus on preventing Type 2 diabetes through lifestyle modifications, which highlights the importance of education in managing this global health issue. Community programs that promote physical activity and healthy eating can make a significant difference. As we continue, we will see how directly diabetes can impact bodily functions, further emphasizing the need for effective management and lifestyle choices. By understanding the types and causes of diabetes, we can better address this widespread health challenge. Diabetes primarily affects the body's ability to produce or use insulin effectively, leading to elevated levels of glucose in the blood. This disruption in insulin function is a hallmark of both type 1 and type 2 diabetes, though the underlying mechanisms differ between the two types. This chronic elevation of blood glucose, known as hyperglycemia, can lead to various complications affecting nearly every organ system in the body. Over time, the persistent high sugar levels can cause significant damage, making diabetes a major risk factor for numerous health issues. One of the most critical systems affected is the vascular system, where high glucose levels damage the blood vessels, leading to poor blood circulation throughout the body. This vascular damage is a primary contributor to many of the severe complications associated with diabetes. The damage to blood vessels from sustained high blood sugar is twofold. It can lead to both macrovascular complications, affecting larger blood vessels, and microvascular complications, affecting smaller blood vessels. This dual impact underscores the extensive reach of diabetes within the circulatory system. Macrovascular complications include increased risk of heart disease and stroke, which are leading causes of mortality in diabetic patients. The heightened risk is due to the accelerated atherosclerosis, or hardening of the arteries, that diabetes promotes. While microvascular complications can lead to issues like kidney disease, vision problems, and diabetic retinopathy, which is a leading cause of blindness. These complications arise from damage to the small blood vessels in the kidneys and eyes, and neuropathy, a condition characterized by nerve damage, which is particularly relevant when discussing erectile dysfunction. Neuropathy can cause pain, tingling, and loss of sensation, significantly impacting quality of life. Moreover, diabetes can impair the body's ability to fight infections, leading to a higher risk of skin conditions and more severe complications if wounds occur, as they heal slower than in individuals without diabetes. This slow healing is due to poor blood circulation and reduced immune response. This aspect of diabetes underscores the importance of meticulous management of blood sugar levels to prevent these myriad complications. Regular monitoring and maintaining blood sugar within target ranges are crucial steps in managing diabetes effectively. The interconnectedness of these complications with overall health cannot be understated. Each complication can exacerbate others, creating a complex web of health issues that require comprehensive care. They elucidate why comprehensive management of diabetes is not just about controlling blood sugar, but also about maintaining overall vascular and nerve health. This holistic approach is essential for preventing the cascade of complications that diabetes can trigger. As we transition into discussing erectile dysfunction, it becomes evident why maintaining good vascular health is imperative for preventing this and other related conditions. Erectile dysfunction is often an early indicator of vascular problems, highlighting the need for proactive management of diabetes. Erectile dysfunction, often referred to as impotence, is a medical condition in which a man is unable to achieve or maintain an erection sufficient for satisfactory sexual performance. This condition can be distressing and can significantly impact a man's self-esteem and intimate relationships. This condition can result from both physical and psychological factors, including diabetes, heart disease, stress, anxiety, and depression. Each of these factors can contribute to the development of erectile dysfunction in different ways, making it a complex issue to address. The symptoms of erectile dysfunction are primarily the inability to have an erection or maintain an erection long enough for sexual intercourse. This can lead to frustration and a decrease in sexual satisfaction for both partners. The causes of erectile dysfunction are varied, but most commonly involve problems with blood flow to the penis. Adequate blood flow is essential for achieving and maintaining an erection, and any disruption in this process can lead to erectile dysfunction. This is why conditions that affect vascular health, such as diabetes and hypertension, are frequently linked to erectile dysfunction. These conditions can damage blood vessels and reduce blood flow to the penis, making it difficult to achieve an erection. Other physical causes include hormonal imbalances, nerve damage, and certain medications that might interfere with the necessary blood flow or nerve functions required for an erection. For instance, medications for high blood pressure or depression can sometimes have side effects that impact erectile function. Psychological factors also play a significant role in erectile dysfunction. Mental health issues can be just as impactful as physical ones when it comes to sexual health. Stress, anxiety, and depression can interfere with sexual feelings and lead to or worsen erectile dysfunction. These psychological factors can create a mental barrier that prevents the natural process of arousal and erection. Moreover, the performance anxiety that can come with erectile dysfunction might create a vicious cycle, exacerbating the condition. The fear of not being able to perform can lead to further stress and anxiety, which in turn makes erectile dysfunction more likely. Understanding these causes and symptoms is crucial for effective management and treatment of erectile dysfunction. By identifying the underlying issues, whether they are physical or psychological, appropriate treatments can be pursued. It's important for individuals experiencing symptoms of erectile dysfunction to consult healthcare providers to rule out underlying causes, including diabetes, that may need targeted treatment. Early diagnosis and intervention can significantly improve outcomes. This is particularly pertinent as we explore the specific link between diabetes and erectile dysfunction in the next section. Understanding how diabetes affects vascular health and contributes to erectile dysfunction can help in developing more effective treatment strategies.